Hello everybody, my name is Dr. Shadi Ireifej, board certified veterinary surgeon, and I hope this video will add to your current understanding of your pet's condition, helping you to make an informed decision regarding your pet's care. Remember to always follow the recommendations of your veterinarian or veterinary specialist closely. Today we're going to be focusing on gastric or stomach obstructions in dogs and cats. We'll start off by showing where the stomach is located in the abdominal cavity of your pet. Gastric obstructions or stomach obstructions are very common, most commonly associated with foreign objects and less commonly associated with tumors. In the upper picture here, you can see the anatomy of the stomach as it leads into the proximal small intestinal tract known as the duodenum. The esophagus, which connects the mouth to the stomach, transmits food into the stomach. Portions of the stomach include the fundus, the body, and the pylorus. Food will then move into the duodenum first, which is the initial part of the small intestinal tract. And as I mentioned, most commonly we find foreign objects in the stomach. However, it's not always the case. Make sure you let your veterinarian know that if your pet is prone to ingesting things they shouldn't be ingesting, like foreign objects, that's a possibility. But of course, pets can be very tricky. And so despite your pet never having had a history of ingesting foreign objects, it's always a possibility they could have eaten something they should have eaten. Please check my previous videos regarding small intestinal obstructions as far as details on what kind of tests are performed and how our decision making plays a role with these types of cases. Now, once there's deemed an obstruction in the stomach, whether it be a foreign object or a tumor or a cancer, we then have several surgical options available to us as surgeons. On the bottom, you can see here a gastrotomy versus a gastrectomy. Now, a gastrotomy involves making an incision to the stomach. That incision is enclosed, reopposing the edges, and reconstructing the stomach. A gastrectomy, or a partial gastrectomy, is when a portion of the stomach is removed. This is most commonly due to either severe damage to the stomach or due to a tumor or growth in the stomach. Now, there are some scenarios where the foreign object might be stuck in the throat or the esophagus, or it may be stuck in the proximal intestinal tract, like the duodenum. The foreign object can then be pushed into the stomach if it's stuck in the throat, or be pushed up into the stomach from the intestinal tract, and then a gastrotomy is performed. Gastrotomies in general tend to be easier recovery with a smaller risk of complications when compared to small intestinal surgery. And again, I urge you to check out my latest videos on small intestinal obstructions and surgical techniques involved with that to discuss the complications that are at risk for those patients. Now, gastrectomy, partial gastrectomy surgeries, of course, have a much higher complication rate and a longer recovery. So whereas most pets will stay in the hospital for a couple of days after a gastrotomy, gastrectomy cases may be in the hospital for 4 or 5 days even, depending on the scenario and how sick the pet is. Of course, most pets that require gastrectomy usually are sicker pets, and so they're going to be in the hospital for a little bit longer, and of course, they'll be more prone to complications because they are, by their nature, more ill than gastrotomy patients. Pets will be managed for a few days on IV fluid therapy, IV antibiotics, pain medications. They'll be offered water after surgery, usually somewhere between 12 and 24 hours after, and then food sometime after that, depending on if they tolerate water. Once your pet is feeling good, meaning they're pain-free, they're eating and drinking well, and there's no more vomiting, no more evidence of nausea, they can go home. Your veterinarian will meet with you to discuss instructions for aftercare, see you in 10 to 14 days to review the incision and to see how things are going at home. Further instructions will be dependent on why the gastric surgery was performed. If it's a gastrotomy, most pets will see the veterinarian at 10 to 14 days after surgery, and then from there, there's no further rechecks regarding that particular surgery. However, if a partial gastrectomy was performed and a tumor or a cancer was removed, further follow-up by other specialists or by your family veterinarian may be indicated depending on how successful the surgery was in removing all the tumor, what kind of tumor we're talking about, whether or not the tumor was benign or malignant. Overall, the prognosis for foreign body ingestion, as long as the patient does well after anesthesia and surgery, is excellent. Surgery should be curative in those cases. Partial gastrectomy cases will be dependent on what the cause was. If the stomach was injured severely by a foreign object or by a stomach disease, then those surgeries tend to be curative, as long as the patient does well with anesthesia and surgery. If a partial gastrectomy is performed because of a tumor or a cancer, that the prognosis will depend on how the healing underwent further post-op, as well as what the diagnosis finally is. I hope this video adds to your current understanding of your pet's condition, and it will help you make an informed decision regarding your pet's care. As always, please make sure to follow the instructions of your family veterinarian and veterinary specialist closely. Please support my channel by subscribing, hitting that like button, and sharing this video with other people. I want to thank you so much again for your time. This is Dr. Shadi Ireifej, and let's take care of our pets.